Greetings to everyone. I'm Dr. K.S. Shubhrata, Professor of Psychiatry at Subbaiah Institute of Medical Sciences, and I'm a consultant psychiatrist at Sridhar Nursing Home, Shimoga. So I'm here today to talk about management of anxiety. So how to manage anxiety. So let me share my screen with the PowerPoint. Okay. So anxiety is a very common emotion, one of the very common multiple emotions which we encounter in day-to-day life. You feel fearful, you feel anxious, you feel happy, you feel sad, you feel angry. So all these things are different emotions encountered in everyday life. And what we are trying to look at today specifically is in relation to anxiety, feeling anxious, which might be disabling, dysfunctional for many of us. So when we try to look at anxiety problems, they are quite common in psychiatry. When you look at different mental health problems, anxiety is very common, has very high prevalence, and it can cause significant disability. But the good part of it is it is quite amenable to treatment. I mean, you recognize it early and try to handle it in a better way, in a systematic way, you will be able to overcome this anxiety quite well. So before we move on to different anxiety problems, we need to know what is the difference between anxiety and fear. See, let me start with to explain this to you with an example. You can see a slide here where there's a shark and a fish. I mean, there's a fish. Okay? Let's take ourselves as an example. Like I try to enter a sea where I try to swim, and I know there's right in front of it. Right in front of me, I see a shark, and I know the danger, imminent danger, is right in front of me. That's when I feel fearful. Whereas I enter a sea to swim, but then I don't see anything, but I'm anticipating there might be shark, there might be something. Then that is how you anticipate and you think. And then out of those thoughts, the anxiety, the feeling emerges. That's called anxiety. So basically the danger, the imminent danger is known in case of fear, and it is not known, it is about in anxiety. You're entering a cave, a dark cave. So if you're not sure what is going to happen, what might be there inside, what might cause you trouble, what might cause you danger, then that's called anxiety. So you know that there's a tiger in front of you. Tiger suddenly jumps, cheetah jumps in front of you, and that's when you feel fearful. So anxiety is basically apprehension about a future threat, and fear is response to an immediate threat. And both involve physiological arousal, and both can be adaptive as well. And remember that fear triggers flight or fight response. You either run away from the place or you fight back. And because of these things, these emotions actually will save, fear will save life and increases preparedness. And to some extent, anxiety can improve performance. So when we try to look at different anxiety disorders, there are most common psychiatric disorders which you see in your clients. There are different kinds of anxiety disorders like specific phobia, social phobia, panic disorder, generalized anxiety disorder, obsessive compulsive disorder. And when you try to look at the common thing or outpatient, most of them, 25% of them report anxiety symptoms. So let me try to give you a very brief overview about each disorder, then talk about managing anxiety in day-to-day life. See, generalized anxiety disorder is something where you feel anxious for all day-to-day activities. For example, a homemaker who is who is quite efficiently, who would manage the whole house, children, husband, cooking, everything, now starts feeling anxious for daily chores, getting her child ready for the school, getting preparing the dishes, or cleaning the house. For everything, she starts getting very anxious. So that's generalized anxiety disorder. Then you have specific phobia. Specific phobia is something very intense fear or anxiety for a specific thing. Uh, like as in the picture, arachnophobia for spider, or height phobia when you're very scared of heights. This is very important. Social anxiety disorder. Most students actually have this problem, and they actually, because of this, their performance in school, performance in the college is hampered. So, what is social anxiety? Anxiety is specific to social situations where you are exposed to social situations. It's called social anxiety. What is panic disorder? Panic disorder is panic attacks. So, episodes of intense anxiety wherein a person would actually start having different physical symptoms as well as thoughts, anxious thoughts. So, this is panic attack. Then the last one is obsessive compulsive disorder, where you find a lot of repetitive thoughts. For example, you feel that your hands are not clean, you want to clean it again and again, wash it again and again. You take bath for 1 hour, still you feel that it's not enough, you're still dirty, so you want to wash, you want to take bath for 2 hours, you want to use lot of water, or you want to check the door whether it is locked properly or not. You want to check whether the gas cylinder is closed, the lock is closed or locked or not. So repetitively, you do things often. That's called obsessive compulsive disorder. So that comes under anxiety disorder because people tend to get very anxious that this is not done properly. So they do it often, again and again, which is quite dysfunctional. So when we try to look at anxiety disorders, there are okay. Okay, when we try to look at anxiety disorders, there are comorbidity as well. With anxiety disorders, you have mood disorders. You have, when I say mood disorders, it means depression. Many of them can have depression along with anxiety disorders. Many of them have alcohol, substance related disorders. When you try to check why did you start alcohol, someone is dependent on alcohol, you can ask why did you start. They would say, I felt very anxious attending the function, so I would take alcohol and feel a little better, then I would go for the function. That's how I started, got dependent on alcohol. So it's quite, anxiety problems are quite prevalent, highly prevalent. Anything from 4% to 8.8% is the prevalence of anxiety disorder, and lifetime prevalence is 7 to 11%. So then most of us will be actually wondering, why do people develop anxiety? See, there are different kinds of etiological factors. It is always multifactorial. There are genetic factors, and shared environmental and genetic factors, and there are some developmental factors. What are the developmental factors? Factors in the family environment, such as style of child rearing, what kind of child rearing was done by the parents, and restricted exposure to social situations within a family. For example, we have a very nuclear family setup these days. Lot of addiction to screen, not going out frequently, social interactions has reduced. So these kind of, the children of this era are not exposed to the social setups as in the previous generation. So that also might lead to anxiety, development of anxiety in their later period. And we also see that the tendency of this anxiety can be observed as early as in infancy. Some infants, as young as 4 months, they tend to become very agitated, start crying in normal settings. You might just recall children in your infants in your neighborhood who would actually, some kids or some babies in the family are quite okay with even strangers. They are quite okay. They're quite comfortable. But there are some infants, there are some toddlers who are actually very specific that they want to stay with their parents. They don't go to anyone else. They feel very anxious, start doing ruckus when they are with strangers. So that also predicts some kind of anxiety in their later childhood, later adolescence or adult. And we also see that the chronic exposure to an environmental stressor in the early life, broken family, death of a parent in the early childhood can actually lead to anxiety in later situation, or exposure, history of childhood sexual abuse can actually lead to anxiety in later life. But then, what do these situations in the environment, child rearing, all these can contribute to the development of anxiety? We also have to remember that there's a clear biological basis for anxiety. The hippocampus may predominantly, like, there are parts in the brain like hippocampus and dorsolateral thalamus, which act hypothalamus, which actually these parts in the brain are when there is a problem in these parts in the brain, I mean, hyperactivity or decreased activity or neurotransmitter system, supersensitivity of serotonin system, noradrenaline system, dopamine system. So all these will contribute to the increase in anxiety as well as maintaining the anxiety, and so that might be the actual etiology of anxiety, for which actually we give medications, try to treat them. And the physical symptoms which we will be talking later actually is actually due to the autonomic dysfunction, overactivity of the sympathetic nervous system. There are two kinds of nervous system, sympathetic as well as parasympathetic. When you have overactivity of sympathetic nervous system, this is what happens. And we need to remember that for anxiety, uh, the way we think determines the way we behave or the way we feel. So, in people who have anxiety, they have different kinds of history. Like, for example, biased attention to threat, tendency to notice negative environmental cues, perceived control. Like, for them who believe that they have little control over themselves are more vulnerable to anxiety disorders. And probably some kind of marked insecurity about one's own ability, decreased self-esteem, decreased self-confidence will lead to some kind of phobia in the future. Okay. And some kind of negative life event often precedes the disorder onset. For example, some student would might say that, I was perfectly normal till 1 year ago. 1 year before that, I gave an exam and I failed in the exam. And after that, I have lost confidence and I feel anxious for many reasons. For even for just presenting something on the stage, I am not able to do that. So that can happen as well. Negative life events can also lead to anxiety. Okay. So when we try to come to the symptoms and signs of anxiety, you can divide them into two kinds of symptoms, psychological and physical. So psychological symptoms can be feelings of fear, impending doom, apprehension, dizziness, faintness, restlessness, exaggerated startle response. Someone comes and touches you from behind, you startle, you are scared. So poor concentration, irritability, insomnia, night terrors, and globus hystericus. Some of them come to us with a lump in the throat. They would have got investigated for everything, but you feel a kind of sensation in the throat which is very uncomfortable. And lot of themes of misfortune and belief of inability to cope with stress. I won't be able to perform this exam. I won't be able to do well. So these are the kind of thoughts they might have because of anxiety. Physical symptoms wise, you have cardiovascular, palpitations, tachycardia, increased heart rate, chest discomfort, dry mouth, lump in the throat, nausea, abdominal discomfort, diarrhea, increased respiratory rate, difficulty catching breath, chest tightness, urinary frequency. See, this slide tells you that there can be symptoms related to any system in the body when you have anxiety. So anxiety can manifest as symptoms of different systems, physical organs, like urinary frequency. You might have seen that, before you have a seminar, you tend to go to use the restroom twice or thrice. When you are very anxious, you might do it more often. Okay. Phobia is something which we discussed earlier. It's a persistent excessive fear. Exposure provokes anxiety, which may manifest in situationally bound or situationally predisposed panic attack. And as I've told earlier, fear is out of proportion to the actual threat. Okay, and what is important is you are worried, you should be worried about your phobia only if it interferes with daily life, job, or social situation, life. For example, if you're afraid of spider, that is okay. If you have phobia about spider, that's okay. Because how many times in a day, how many days in a year you encounter spider? You might just make sure there are no spiders in your home. That's fine. So, but then if you are very scared of traveling in a bus, if you are scared, if you are phobic about going out in a crowded place, then that's a problem, because you cannot survive without going to a crowded place. You cannot be housebound all the time. So that is when you require treatment. Okay. So social phobia is something which requires a lot of attention because many students, many people develop this social anxiety. Remember that it starts during adolescence and it can be generalized or specific. For exam phobia, you can have exam, or you can have anxiety in when you are presenting your practical exams. So it is more intense than mere shyness. I think I feel very shy going out, but then I manage to go out later. Once I get used to the environment, I am better. So that is shyness. But then phobia, social anxiety or social phobia, a social anxiety disorder is that it is out of proportion to what is shyness, and you tend to avoid the situation because of that. Okay. And panic disorder, we have discussed earlier. A panic attack, I will just show you what is a sign of panic attack. It's a time of very intense anxiety. Some of you might have actually experienced it. You start racing, you start the feeling of the racing of your heart, the heartbeat increases, is trembling, numbness, dizziness, increased sweating, dryness of mouth. So there's something called cognitive behavior model, which all of us should remember. See, Clark's model of panic. See, there's a trigger. I mean, for example, the trigger is that I want to enter, I am entering a class and I am going to perform my musical night in front of 100 strangers, all of them are new people. So the trigger is that. And the moment I go, I feel slightly anxious and I have an increased heartbeat. So the moment I have increased heartbeat, what happens is the perceived threat increases. I feel that oh, something is wrong. I've started sweating, so that will cause apprehension. The moment I am apprehensive, that will increase the bodily sensation. I feel anxious. The bodily sensations like dryness of mouth, sweating increases, tremors can start happening. So this can happen, which will lead to catastrophic misinterpretation. So what is catastrophic misinterpretation? You are thinking that you are going to end up with a heart attack. So that will again increase the perceived threat. That vicious cycle continues on and on, which I actually, at the end of it, I might just avoid entering the hall. I might just cancel the program. Okay. So once you are panicky about it, as I said, you try to escape from the situation or you avoid the situation, or you do some safety behaviors. Like, for example, keep touching your head, keep using your kerchief and handkerchief, or keep clearing your throat and avoid eye contact. These are the safety behaviors. Okay, so this we have discussed. Okay, see, this is a very just a slide just for your information that we have very good medications for anxiety disorders, which needs to be taken only in severe cases, moderate to severe cases, and which needs to be taken with the consultation with a psychiatrist. As let me stress it again, it needs to be taken with a psychiatrist. Then you have the behavioral control, the cognitive behavior therapy. Actually, a proper kind of cognitive behavior therapy needs to be done with a professional psychologist who is trained in psychology. So, but then there are some principles of CBT which can be used by us the way we think. See, the basics, the principle, the premise of CBT, cognitive behavior therapy for anxiety, is that your thoughts, not your current situation, affect the way you feel and the way you behave. See, basically it is the way you think determines the way you feel or the way you behave. It is not about the situation. For example, if I am attending a seminar, the same example I would take, then it is not about a situation wherein you have 100 strangers. But the way you think about the situation actually determines the way you behave. If you can think positively about it, you can actually face the situation well. Though you have 100 strangers right in front of you, though you feel anxious. So the goal of CBT is to identify and understand your negative thinking and change the behavioral pattern and replace that negative thoughts with more realistic and positive thoughts. So there are some common errors of thinking. I mean, if you can think about these common errors, I mean, you might also, all of us might have this kind of thinking. Probability overestimation. For example, if you're crossing the road, you are an anxious person, you would think that the chance of you having an accident while crossing the road is 1 in 1 lakh probably, or 1 in 10 lakh. But then if you are a person who is very anxious, you would think that every time you cross the road, you feel that you're anxious that you might end up with an accident. Okay. So for example, for a small child who is a toddler, I mean 5 or 6 year old, he wants to, or 7 or 8 year old who wants to try to play with the, I think want to play the cricket. So if you are a person who is very anxious, if your mother who is very anxious and overprotective, you would estimate the probability of the child having an injury by the bat or a ball very high. So you would avoid sending your child for playing cricket. So the probability overestimation is a common error of thinking. Catastrophization. The second thing is you have a child, you're sending the child for the 7 or 8 year old for the cricket, and then the chances of being hit with the ball sometime having an injury is common. It might be there, but then you catastrophize it and you think something happens, something bad might happen for the child, so you don't send the child. So some mild injuries are okay. Children need to grow up with those injuries. So that's called catastrophization. All or none thinking. You think that you need to do it perfectly or you will not do it. So that is never going to happen, because to err is human. You might make a mistake, but that is okay. Jumping to conclusion. Someone, you are doing a seminar, same example I am trying to explain to you with the same example because it might be easy for all of you to understand. So you jump to conclusion. Two students are talking amongst themselves. They smile at each other when you're talking in a seminar. And immediately you jump to conclusion that they are talking bad about me. So unless you clarify, you should not be jumping to conclusion. And overgeneralization. Just because that day your computer did not work when you are doing your program, your slides did not come up. So you try to generalize and think every time that this will happen every time. So let me avoid the situation. This is overgeneralization. So these errors of thinking need to be recognized amongst ourselves and we need to try to change with the realistic way. So some kind of chart like this would help in self-monitoring, like example, date and time. So what was the triggering event for your anxiety, running late for the class? And what were the thoughts which started after this triggering event? That I might get this thought that, they will think I'm irresponsible, I'm not going for the class regularly. Then the sensation, what sensation you could get? Sweating, increased heartbeat, feeling nervous. Then what did you do? How much anxious you felt? If you can monitor your anxiety in a better way, like for example, you have an exam, so practical exam. So what was the triggering event? That the morning you get up, you remember that you have a practical exam, that's a triggering event for you. So what are the thoughts? That I might not perform well. I might pass out in front of the examiner. My experiment would not work. I might forget my hall ticket. So then you have the sensations. Try to understand the sensations or the emotions, what you have, physical symptoms. Then after that, you try to uh, uh, rate your anxiety on 0 to 100. So the moment you know this is how you're feeling anxious, then you can try to change your way of thinking. Some exposure therapy is what is used generally for anxiety. Relaxation is something, this needs to be done with a therapist, with a professional. But then some kind of principles there are some apps on the in the web, good reliable sources where you can actually do this. See, something very specifically which I would want all of you to know about is Jacobson's progressive muscle relaxation. Just hold your hand. You can do it now right in front of me. Hold it, make it into a fist, make it very tight. So do you feel the pain in your fist? Yes, I'm sure you feel, if you're holding it very tight, you feel the pain. If you just let it loose, relax, the pain vanishes. See, this is the basic premise of Jacobson's progressive muscle relaxation. You try to relax all parts of your body in a very systematic and progressive way. This is very much akin to Shavasana in Yogasana. But this is a time-tested and very evidence-based progressive Jacobson muscle relaxation, which is very helpful in countering your anxiety. Then deep breathing techniques, meditation, and guided imagery. I think this is something which you can. Jacobson's progressive muscle relaxation is something which you can try. I mean, you can get it from the reliable source and try to practice it in your day-to-day life. Second thing is trying to make a list of your anxiety provoking triggers. So, what provokes anxiety? When do you feel anxious? Attending a class, attending the practical exam, or giving exam, or seeing your friend, or talking, singing on the stage, talking on the microphone, whatever. Then try to expose yourself in a graded fashion. For example, if you are very scared of heights, don't expose yourself to 14th floor. Start with first floor, second floor. Try to stay for only 5 minutes, 2 minutes, 3 minutes, come back. Try to do relaxation during that time if you feel anxious. And the last other thing is dialectical behavior therapy is also found to have some good utility in anxiety. Mindfulness is something which is quite useful, which can be learned from a professional and then practiced every day. Connecting with the present moment and notice passing thoughts. You try to understand your own thoughts without being ruled by them, without being judgmental about your thoughts, and try to manage your anxiety when faced with a stressful situation. And the once you know that there is anxiety, you recognize that. Then you being aware of one's own anxiety is actually half this thing management done. Third thing is interpersonal effectiveness, learning how to say no, ask for what you need, assertiveness skills, and emotional regulation. Recognizing and managing anxiety before they get out of control. Once it's out of control, you will have to see one of us as psychiatrists, mental health professionals. So before that, you need to understand and then try to manage it. So, I mean, to conclude, I think anxiety to some extent is good, because if I am anxious about this talk, what I would do is I would prepare well. My preparedness would be better. I would make sure that I have slides ready. I will make sure that I am ready with the content which is good for students. But then if it becomes too much anxiety, I would avoid attending this talk. I would avoid recording this talk. I would become very anxious. My heart, my hands might start trembling. I might not speak in a clear voice. So to some extent, performance anxiety is okay. But then if the anxiety starts troubling in your day-to-day life, you should become aware about it and try to tackle it in a professional way. Thank you.